Next investigation in the list is vitamin B12. And what is the normal range? It is between 200 and 900 nanograms per milliliter. It is considered low when it is below 200 and high when it reaches above 900 nanograms per milliliter. So the low levels suggest some neurological symptoms, whereas the high level results in liver, kidney disease, diabetes, and some forms of leukemia. Testing vitamin B12 level is important because it is necessary for several bodily functions like nerve functions, protection of DNA, and formation of red blood cells. Deficiency of vitamin B12 results in certain signs and symptoms, which are confusion, dementia, depression, tachycardia, numbness, or some tingling sensations in the peripheries, poor memory, sore tongue. There is a condition called pernicious anemia, which results from an inability to absorb vitamin B12. It often affects older adults, those who lack intrinsic factor. And what is this intrinsic factor? It is a substance in the stomach which binds to vitamin B12 so that the body can absorb it. And symptoms of pernicious anemia includes constipation, fatigue, loss of appetite, pale skin, and weight loss. The following groups of people are more likely to experience low vitamin B12 levels. They are older adults, children, vegetarians, diabetic individuals, and people with conditions that reduce B12 absorption like celiac disease, Crohn's disease, people who have had gastric bypass surgery, breastfeeding individuals, people taking medicines like chloramphenicol, proton pump inhibitors, and H2 blockers. Now at last, what are the foods rich in B12? They are fish, seafood, meat, eggs, dairy products, plant-based alternatives like green leafy vegetables, fortified nutritional yeast. And what is the recommended daily allowance? It is normally 2.4 micrograms per day, which increases up to 2.6 in pregnant women and 2.8 in breastfeeding individuals. Next one is HbA1c, glycated hemoglobin. So measurement of this glycated hemoglobin is the best index of long-term control of blood glucose level. We should know testing of glycated hemoglobin values. They are not for diagnosis of diabetes mellitus, but only for monitoring the response to the treatment of diabetes. So the HbA1c level reveals the mean glucose level over the previous 10 to 12 weeks. It is unaffected by recent food intake or recent changes in blood sugar levels. And how it is possible to take over the previous 10 to 12 weeks. Normally the glucose combines with the hemoglobin in red blood cells. Once the glucose is attached, it is not removed from the hemoglobin. And we know the lifespan of red blood cells is 120 days. And that is why the estimation should be done at least every 3 months in all diabetic patients. So normally the level of HbA1c is less than 6%. The value 6% denotes very good control of diabetes by treatment measures. 7% means adequate control, 8% inadequate control, 9% means very poor control, and any values between 6.5 and 7 are considered as impaired glucose tolerance. For clear understanding, let us express the values as same units that patients see routinely in blood glucose measurements. So 6% represents 126 milligram per dl. 7% means 154. 8 is 183. 9% means 212. And HbA1c 10% equals 240 milligram per dl. An elevated HbA1c indicates poor control of diabetes mellitus, and the risk of retinopathy and renal complications are proportionately increases with the elevated HbA1c. So when there is reduction in 1% of HbA1c, it will decrease long-term complications to an extent of 30%. The first line of treatment is always diet and exercise. And two types of oral hypoglycemic drugs, which are sulfonylureas and biguanides. Then insulin injections. These oral hypoglycemic agents are mainly used in type 2 diabetes, and insulin is the drug of choice for type 1 disease. So we should know hyperglycemia causes harm to our body, but hypoglycemia is fatal. A fall in plasma glucose level less than 50 mg per dl is definitely a life-threatening situation. Thank you.